What I love about Omada is it's incredibly nerve-wracking from a business standpoint to sign a contract where there's not any revenue from it unless we get people into our program, we get them through our program, and we get them to lose meaningful weight. But that's awesome because what that does is it puts our feet to the fire.
The outcomes that we're really trying to achieve happen in a patient's body. And the trap that other companies have fallen into in this space in the past is assuming that delivery of the program is the same as a meaningful clinical outcome in a patient's body. And that's just not true.
I think it's important to publish and be transparent with outcomes for a whole host of reasons. One, if you're not delivering a clinical outcome, why are you in business?
Each new Prevent participant really benefits from the learnings that we get from the thousands upon thousands of previous participants that have completed Prevent. We're at a point now where we can tell fairly early on how a participant is likely to do much later in the program. Using this knowledge, health coaches can intervene to get a participant back on track before they actually get off track. And this has really changed everything.
Anytime an HR customer of ours asks me how they should evaluate programs, I tell them to go out and look in the clinical literature for peer-reviewed publications on whether or not those programs produce outcomes. We're moving to a point in time where real medicine is being paid for by employers, and employers need to learn about it.
I would challenge people to say, why am I paying a per employee per month or a fixed fee rather than focusing on paying for outcomes? When a vendor or a partner comes to me and says, I'm going to deliver this, we should pay them on what they say they're going to deliver. And that's something that's totally missing in healthcare.
People can do a lot of things, but it may have no impact on their body and their health over the long term because it doesn't actually change their behavior in a meaningful way.
We are trying to change the game. We're trying to say that this is something that's hard. It's been hard for you. It's been a problem for you. It hasn't been solved. Healthcare costs are still rising. So you need partners that will align their financial incentives to you. And that is something that we're willing to do.